All right, so hi there, everyone, and thank you so much for watching this Let's Manage Endo e-learning module brought to you by Quendo. My name is Kayla, and I'm the owner of Mind Over Endo Pain Meditations, and I'm so excited to present as part of the Let's Manage Endo program to teach you about the science and magic of mindfulness and meditation for rewiring our endo pain brain and helping us find some relief from this illness. So let's get started. Now, before we begin, I just want to note that this presentation does not replace treatment provided by medical and allied health professionals. The treatment of endometriosis responds best to multidisciplinary care. Please consult with your medical professional before commencing with any of the information provided today. And just remember that meditation is meant to complement, not replace, our other treatments on this journey. So I'll just start with a little bit about me before we fully kick off. So I'm originally from Canada, but have now lived in Australia for about 12 years now. I'm a behavioral research scientist, which essentially means I research the attitudes, beliefs, and behaviors of people doing certain habits, and then design policy and educational interventions to help encourage better behavior. This was mainly in the public health space, and I've now extended this same approach to being a meditation teacher for endometriosis pain, ensuring that those suffering have access to meditation as a point of care. My main goal is to help reframe what meditation can do to help your pain. As I myself, who was a meditator for years, assumed the doctor thought it was all in my head when they mentioned meditation, but it ended up helping me so much and essentially changing my life and my relationship with pain. So, my mission is to help endo warriors understand the science and benefits of it so you can enjoy its absolute magic too. So, with that in mind today, we'll be covering my top tips and strategies, which are first understanding your pain triggers and soothers. And then I'll run through all of the key science backed mindfulness and meditation techniques that just help to rewire our pain brain and give ourselves emotional relief. And then I'll finish off with a short meditation at the end so you can witness the benefits firsthand. So, without further ado, let's learn why meditation is one of the best treatment tools on our journey. First off, it's important to know what mindfulness and meditation are in case you don't know. So, mindfulness is the art of tuning into the present moment with any of your senses, be it sound, touch, or smell, and focusing on something specific like your breath, an object, or a mantra, while gently bringing yourself out of any mind wandering. And we want to do all of this with kindness and compassion. And this is the hardest part without judgment. We are not trying to shut down our thoughts or empty our minds because that would be impossible, but bring conscious awareness to them and regain focus of the present moment. Now, that's mindfulness. Now, meditation, on the other hand, is the practice of getting good at mindfulness. It's dedicating anywhere between 5 to 20 minutes a day, or even just 1 minute, just to start small, just to practice mindfulness so that we can do it more innately in real life. It's like going to the gym to strengthen our muscles so that we can do all kinds of fun, heavy lifting in life. It is a skill like driving a car, and like any skill, it will take time and practice. But please know that anytime you catch yourself mind wandering, that's great. That's a bicep curl for the brain. That is a magic moment of mindfulness. So just keep bringing yourself back to the present moment, even if you have to do it over and over again. That's completely normal and will always happen. So, how does meditation ease something as debilitating as endo pain? Now, a lot of people may think meditation is woo woo junk science, but it is backed by reams and reams of verifiable research on its effectiveness for pain. It's especially important to know that the brain is plastic and moldable, like a 3 pound lump of Play Doh, and can change and be rewired. This is called neuroplasticity. Meditation fosters neuroplasticity by increasing blood flow to the brain, strengthening the brain's neural pathways responsible for calming our nervous system, including our prefrontal cortex, which is the newest part of our brain and is responsible for emotional regulation, logic, and decision making. And the more we grow these areas through meditation, the more that they become our default when we're out in everyday life. This, in effect, reduces our fight or flight response while also enhancing our emotional regulation, allowing us just to pause before reacting, especially to an aggressive endometriosis pain flare up. It also eases pain by increasing our self compassion, which eases the awful emotional overwhelm and also helps to reduce negative thought patterns that can increase the production of the stress hormone cortisol, which can lead to cortisol dysfunction, which obviously makes our pain just so much more worse. When we practice self compassion meditations in particular, we activate something called our mammalian care system, which releases amazing neurochemicals like oxytocin and endorphins. So we open up our brain's pharmacy for pain relief. There are so many other ways that it helps, but these are just the key ones for today. Now, before going into understanding how mindfulness can actually help the brain rewire itself, let's first start by going over how pain has changed our brain. It's important to know that when we live with chronic debilitating pain like endometriosis, something interesting happens in the brain. Constant chronic pain from our endo changes our brain, causing it to rewire itself for the pain experience. And the more we've been living with pain, the more we end up fearing or resisting pain because it's so awful, which causes our brain's attention to get stuck on it because our brain just wants to protect us from that threat and it knows pain is a big threat to us. The brain then starts highlighting pain signals or even innocuous signals from the body as extremely important, even when the danger is not there anymore, like after a successful excision surgery or other interventions. Now, before going into understanding how mindfulness can actually help the brain rewire itself, let's first start by going over how pain has changed our brain. It's important to know that when we live with chronic debilitating pain, something interesting happens in the brain. Constant chronic pain from our endo changes our brain, causing it to rewire itself for the pain experience. And the more we've been living with pain, the more we end up fearing or resisting the pain because it is just so awful, which causes our brain's attention to get stuck on it. Remember, our brain is always just trying to protect us from threats, and our pain is one of the biggest threats that it's clocked. The brain starts highlighting pain signals or even innocuous signals from the body as extremely important, even when the danger is not there anymore, like after a successful excision surgery or other interventions. This constant amplification creates what pain scientists call central sensitization, where even normal sensations like slight gas or even a bit of bloating can start to feel extremely painful. But here's the hopeful part. Research shows that when we practice mindful, curious, and non judgmental attention to our body, we can start to de amplify these pain pathways and rewire our brain back to normal. Another important way to reduce the fear around our pain is to better understand the trigger, which can be from something even beyond our endo pain. Now, pain is a complex biopsychosocial mechanism, meaning it can be influenced by our environment, stress, or even the people that we're around. Dr. Timothy Cox and Dr. Lorimer Mosley are renowned pain scientists who came up with understanding your DIMS and SIMS, which are your danger in me and safety in me triggers and soothers. To better understand this, it's important to know that the pain experience is heavily influenced by various factors, which can greatly amplify it or decrease it, including our emotional state of mind, the things we hear, taste, touch, and smell, the things we think, feel, and believe about our pain, such as I'll never get better, which would be a dim, or my pain is something that I can control, which would be a sim, or the places we go or the environment that we're in, such as stressful workplace, which is a definite dim for a lot of us, or a fun soccer field with your friends watching a game, which is a definite sim for a lot. The people we're around, the things happening in our body, the things we do, and the things we say. These can all greatly influence that pain experience. But thankfully, we can use mindful awareness to better understand your triggers and soothers, and then actively override any triggers with some of our soothers, like doing deep breathing and listening to your favorite podcasts when going to work, if work is a trigger for you. So now that we know what triggers our pain beyond our endo, we're going to dive deep into the techniques we can use to manage our brain's default to pain. These science-backed tools to help rewire our chronic pain brain include deep breathing, visualizations, body scans, mantras, affirmations, and thought challenging, and the bonus one, my favorite, self-compassion. So, mindfulness tool number one is deep breathing. Now, even if we haven't cured our endo, we can still trick the brain into thinking that we're safe. When we combine mindfulness with specific breath work, we stimulate something called the vagus nerve, the body's built in calming switch. And not all that happens in Vegas stays in Vegas, because the vagus nerve is the longest nerve in the body. It's connected to the brain, the heart, the lungs, and our stomach, and influences key parts of our breathing and digestion. When activated through deep belly breathing, the vagus nerve pulls us out of our sympathetic nervous system, which is our fight or flight response, and it down regulates us into something called our parasympathetic nervous system, which is our rest and digest when we're feeling nice and calm and at ease. This is backed by decades of research on the impacts of mindfulness and meditation for nervous system regulation and pain relief. It's science. Additionally, by training our attention gently and kindly, we can rewire our experience of pain. Not by pretending it's not there. Anyone with endo knows it is literally impossible to ignore that kind of pain, but by changing how we relate to it through non judgmental awareness and curiosity rather than feelings of despair and defeat, which are completely natural given everything we endure. I cannot highlight that enough or underscore that enough. It's about helping your body feel safer even in the face of extreme pain. And when your body feels safer, pain often becomes less overwhelming. Deep breathing has a big scientific impact. When we breathe out longer than we breathe in, we activate the parasympathetic nervous system, as mentioned, our rest and digest. Each exhale tells the brain, you're safe, you can relax, you can let your guard down, even in the face of extreme pain. The threat center the threat center of our threat center excuse me, sorry. The threat center of our brain is a little bit dumb, so we can literally fake it till we make it. And deep breathing is so powerful because it helps offload carbon dioxide buildup. It resets our blood gases and calms the body almost immediately. Because essentially, when we breathe, we want to take in oxygen and expel carbon dioxide, and the body keeps a nice, even keel of both. But when we have too much carbon dioxide buildup because our breathing gets shallow, we can get really shaky and even more uneasy. Now, you'll notice that when you're in fight or flight during an endo flare up, your breathing becomes very shallow, which happens instantaneously during a flare up, which is why deep breathing is really the foundation for support and relief through respiratory biofeedback, which again is just a fancy way of saying that we're communicating to the brain and body that all is well, you can settle down. Over time, practicing these breathing techniques can lower chronic cortisol dysfunction, the stress hormone. And since chronic cortisol dysfunction is a massive inflammatory chemical, deep breathing incidentally reduces inflammation, which is great for endo warriors since endo at its heart is an inflammatory disease. We also improve our vagal tone, which is our vagus nerve, meaning a stronger and more flexible response. We also decrease pain amplification by turning down the volume through all the ways that deep breathing signals safety to the brain and body. Now, I know that you covered this in an amazing e-learning module on breath work, so definitely check that out. But I just wanted to show one key element here today, which is one of my favorites. Um, just remember, the more that you practice breathing techniques, even for just a few minutes a day, the more your nervous system learns a new baseline of calmness. And this creates a nice flexible nervous system. This means fewer pain flare ups, a faster recovery, and an overall greater sense of control in your body. Now, I personally very much recommend doing the physiological sigh technique anytime you want to practice deep breathing. And combining it with a count of 4, 3, and 6 can be very helpful. So I'll just do this very quickly right now. So all you want to do is just do a deep inhale through the nose for 4 seconds. Then do an extra quick inhale, filling all the way up. And you can hold that for 3 seconds. and then exhale for 6. You can do that any which way you like. You don't have to do the counting with it, but it can almost instantly make you feel better, especially before a stressful meeting or meet up with someone you're really not looking forward to, or obviously during a flare up. But just be sure to breathe deeply into the sensations and keep repeating it as much as you need until you finally start to feel safe. All right, now let's move on to our mindfulness tool number 2, visualization. In his book, The Brain's Way of Healing, Dr. Norman Doidge talks to Dr. Michael Moskowitz, a renowned pain specialist in the treatment of chronic and persistent pain, who explains that only about 5% of neurons in our brain are dedicated to processing acute pain, which is the type of shorter term pain you may experience for a few weeks when breaking your ankle or burning your hand on the stove. But when we experience pain every day for 3 months or more, the pain becomes chronic. And this is the case for a lot of people with endometriosis. Now, with chronic pain, the constant firing of these neurons causes the brain to develop a dedicated prioritization of this pain processing, resulting in an increase of around 15 to 20% of neurons now being used exclusively for the pain process. Essentially, your brain just starts practicing pain all on its own. This is the central sensitization we talked about just a moment ago. This means that neurons that were once used for those guitar lessons you did years ago or the summer that you learned French are now being stolen and hijacked for processing pain. So, how does visualization steal back these neurons? Well, since all mindfulness tools work on the principles of neural rewiring and nervous system regulation, it's no surprise that visualization stands out as one of the most effective techniques to use during episodes of pain. This is because visualization is one of the most powerful ways to generate something called competitive plasticity. It works by reclaiming the neurons that the brain previously hijacked to amplify chronic pain processing. Visualization helps to reduce the intensity of pain signals by essentially stealing them back and using them for something pleasant and calming. It does this by taking full control over the brain's posterior parietal lobe, which is just an area responsible for both pain and visual perception. And when we use visualization during a flare up, the posterior parietal lobe is no longer able to function in its pain processing capacities, since the visualization of imagery is now taking over and competing with it. This confuses the brain and no longer allows it to properly process the pain signals. Additionally, the brain doesn't fully distinguish between what's real and what's imagined. So, if there are certain physical tasks we can't do because of our pain, visualization allows us to safely expose ourselves to these tasks in a graded way without the risk of pain. Over time, this helps calm the nervous system by reducing those chronic cortisol levels, making us feel more in control when we eventually attempt the task physically. Visualization is not just woo woo, it's deeply rooted in neuroscience. And it's a beautiful example of how the mind and body are connected and how we can use that connection for healing. One visualization technique recommended by Dr. Michael Moskowitz is visualizing your pain maps or pain neurons shrinking every time pain strikes. And you can really imagine or visualize this any way that you like. You can also witness a bright white light absorbing the sensations as you do deep belly breathing. This is one of the most classic forms of pain management. Or one of my favorites is to see the pain as a slice of lemon and gently imagine yourself sucking out the juices over and over and just feeling the sour taste in your mouth. This is really good at distracting the brain and is also really great for people who suffer with aphantasia and can't properly visualize. You can just feel all these things happening. And even just see the sensations as a shape, animal, or a color. Anything that makes the brain process the signal as information and not a threat. You can also visualize your brain turning from red to blue while breathing deeply, which can also be very, very helpful. Now we'll cover our third mindfulness tool, which are body scans. Body scans are desperately needed for endo warriors as the pain oftentimes forces us to just disconnect from our body, where we can feel completely numb or almost having an out of body experience. This is called disassociation and is a maladaptive coping mechanism for survival against the extreme pain. Body scans with non judgmental awareness allow us to reconnect safely to our body, neutralizing the sensations and processing the sensations as information rather than a threat. So, how do mindful body scans trick the brain and de amplify the pain pathways after the brain has changed? Mindful body scans teach the brain to notice sensations without adding fear, worry, or just really bad thoughts. We just tune into it with curiosity, kindness, and a lot of compassion. This allows the brain to reinterpret the pain signal as something that's not terrifying, but something safe and manageable. Again, this takes time with something as aggressive as endopain, but it can work over time. It allows us to reconnect with the body with safe exposure, which also calms the brain down. Resisting our pain often makes it scarier and more threatening. But body scans shift us from this hurts, it's dangerous, to this sensation is here and I can observe it with calm awareness, which is a form of self soothing, especially when combined with our deep breathing. Remember, this can take time, so be very, very gentle with yourself. But over time, body scans have been shown to reduce activity in the brain's pain matrix, which is the network of brain regions that work together to process and respond to painful stimuli. It also strengthens the brain's sensory mapping, making us feel more connected to our body rather than disconnected, while lowering our overall pain intensity. So, even if you notice strong sensations during today's practices, remember you're building new neural pathways of calm attention, and that's incredibly healing and can take time. All right, let's learn some non judgmental awareness techniques that we can do through body scans. So, pain research shows that tuning into the pain and tuning out of the pain are incredibly powerful tools for pain relief, with tuning into the pain being generally viewed as the most effective. This is because tuning into the pain gradually allows us to recognize how the pain changes and moves along with its impermanence, which makes sense because it can be so incredibly scary to truly tune into the pain. So when we face that fear, we're telling the brain, we've got this, you can settle down now. Just remember that when tuning into the pain, helpful non judgmental awareness techniques involve asking very neutral questions about it, such as, where is the sensation? Is it deep or is it at the surface? And what color is it or shape is it? On the other hand, tuning out of the pain allows us to witness places of safety in the body and remind the brain what safety feels like. And this is very commonly tuning into our hands or our feet, just very neutral places in the body. When we combine this with our deep belly breathing, we're developing a twofold action of generating safety in the body through nervous system regulation while also rewiring how the brain is interpreting that pain. All right, now it's time for the fourth mindfulness tool. We're almost there: affirmations, mantras, and thought challenging. Now, when you practice repeating calming words, it doesn't just feel good, it actually interrupts habitual negative thought loops in your brain. Our brains have something called a negativity bias, meaning we're wired to notice threats way more than positives. This made sense for survival for our ancestors, but for chronic pain, it can keep us locked into fear and suffering, making our endo pain even worse with catastrophic thoughts like, will this ever get better? I'm beyond hope, or this is life now, just to name a few. Again, this is completely natural given everything that we've been enduring with this illness. But this is a big problem because your brain is always listening to your thoughts, your internal dialogue, and the messages you receive from the world. Remember, neurons that fire together wire together. So every time you think a thought, you strengthen the neural pathway that supports that thought. So if you often think I can't cope or the pain controls me, which is again completely natural, with everything that you're enduring with your endo pain, you unfortunately reinforce fear and helplessness pathways. But if you practice thinking mantras and affirmations such as, I am safe, I am resilient, or I can hold this moment with compassion, you strengthen circuits for empowerment, safety, and self soothing, especially when combined with our deep breathing, making the body feel physically safe and secure while rewiring these thought patterns. This can be extremely hard to achieve for those with post traumatic stress, which essentially is most people with endometriosis. So be very, very gentle with yourself if you struggle with it. But just start with mindful awareness of the thoughts and then gently reframing them with thoughts like, my body is struggling right now, but I can survive anything because you can. Or just because it's like this now doesn't mean it will be forever. And why are mantras and excuse me, and why are mantras and affirmations such a wonderful way to help reprogram these unhelpful thought patterns? It's because mantras and affirmations work by building new positive wiring by playing on something in the brain called the illusory truth effect. This effect is a cognitive bias and process in which the brain comes to believe repeated information as more truthful than new information. Again, this literally tricks the brain into believing what we're feeding it, which is why manifesting is so effective. It's literally just rewiring your brain to believe you can achieve what you want. And then your brain just does the work of giving you the confidence to do the tasks to make that achievable. But for pain, it works in an amazing way by convincing the brain that we're safe, even in the midst of an awful flare up, allowing it to ease up, knowing that we're in the driver's seat and we have control. This reduces the stress hormones that generously accompany these awful thought patterns and allows us to challenge these unhelpful thoughts. And if we're in a really heavy state of thought rumination, that's okay. It definitely happens. We can also thought challenge even further by doing deep breathing and asking ourselves questions like, is this 100% true? Is there a more compassionate way to view this? What if it all works out? Or what would I say to a close friend going through this, which is my personal favorite? Now we come to the last and most important mindfulness and meditation technique, self compassion. First, let's dig into the science behind self compassion and pain. Research from places like Stanford University and Harvard show that when we practice self compassion, which is essentially just treating ourselves with kindness during difficult times, several things happen. Firstly, we reduce activation in the brain's threat and pain centers, like the amygdala. We also increase activity in areas associated with emotional regulation, safety, and connection, like the prefrontal cortex and our caregiving networks. Our bodies then release oxytocin, the bonding and safety hormone, helping to soothe the nervous system. In studies of people with chronic pain, those who practice self compassion techniques reported lower pain intensity, less emotional distress, and greater quality of life, even without any changes to the underlying physical condition. Self compassion isn't about pretending that everything is fine. It's about acknowledging the truth of our experience and all of the trauma we've endured from this illness with gentleness and reminding ourselves that pain does not make us broken, weak, or alone, and that we've just truly been through so much with this illness. It's one of the most ancient Buddhist practices. The core of meditation is liberation from one's suffering, and there are few people in this world that know suffering better than someone with endometriosis. The Dalai Lama even once said, if you want others to be happy, practice compassion. But if you want to be happy, practice compassion. And while it's great in the emotional sense, brain scans of meditators who practice loving kindness and self compassion meditations, also known as meta meditations, show that the parts of the brain responsible for pain start to quiet and dim down while people are doing these practices. It also has beautiful incidental impacts on our relationships with people because we're filling our cup up first and then have more room for others. As mentioned, when we face pain with fear, anger, or self judgment, we trigger a more sympathetic fight or flight arousal, which can amplify our pain signals. But when we respond with compassion, we activate the parasympathetic nervous system, again, that rest and digest response, calming the body, easing muscle tension, and helping pain to soften. Self compassion does not cure pain by any means, but it changes our relationship to it, reducing suffering layered on top of the physical sensations. We stop turning away from ourselves and our experience and are able to meet ourselves with so much love and safety. This can oftentimes be the first time we've felt this way towards ourselves, so it can be quite emotional at times, especially if you've been gaslit in any way about your experience. And it's something that you can practice and strengthen and come back to again and again. In fact, during a flare up, just gently turning towards yourself and hugging yourself and rubbing your arms up and down while repeating things like, you don't deserve this, but you can get through it, can sometimes bring us out of an aggressive pain flare up faster than our medication. But always take your medication as well. Research shows that body compassion can be even more fundamental for people who live with chronic debilitating pain. And there's so much power in recognizing our intense struggles while still holding appreciation for all that our body does for us. But we can so often neglect our body and its truly remarkable beauty because we're just constantly in pain and we don't want to associate with it. But the recognition of all of the billions of cells and neurons and roughly 78 organs that are working tirelessly around the clock for us is so incredibly important and can be really, really life changing and just really help us soften our approach to our body. All right, enough talk. Let's see some of the amazing impacts of these meditation tools in real time. So I just invite you to begin by finding a comfortable position, either lying down, which I think is probably best, especially if you're in pain, or you can sit up straight, whichever you prefer. And just when you're ready, gently close your eyes or keep an unfocused gaze in front of you, whichever you prefer. And just feel your head, shoulders, belly, and full body slowly relaxing and letting go. And at your own pace, we'll just do some physiological sigh breaths, allowing the calmness to fully wash over us. So when you're ready, just a deep breath in through the nose, expanding the belly. An extra quick inhale to fill all the way up. And a nice long sigh out. One more time, just a deep breath in through the nose, expanding the belly. An extra quick inhale to fill all the way up. And a nice long sigh out. Great job. Just allowing your breath to keep a nice, slow rhythm. We'll just slowly bring your attention to your body, outlining it, starting from your head all the way down to your toes. Feeling each part soften and release as you pass by. Watch as your jaw loosens, your brow softens, and your shoulders drop from your ears. Just notice where the pain or discomfort lives today. Just do it without judgment, just simply observing it, as hard as this can be. And while breathing in and out, we'll just ask ourselves some neutral questions about the sensations. Like, where are they exactly? Are they still or do they move? Is there a shape or color to the sensations? Do they resemble a number or even an animal? Just keep noticing it without needing to change anything while just breathing deeply. Just witness a bright white light form over any sensations, feeling the pain dissipate with every breath in and out, watching as the white light absorbs these sensations. And if it feels good, just gently wrap your arms around yourself in a soft hug. You can even rub your arms up and down and gently bring in this simple mantra. So on the inhale, repeat, "This is hard." And on the exhale, "May I be gentle with myself." Repeat this for a few breaths, letting the words wash over your body like a warm, comforting hug. This is hard. May I be gentle with myself. This is hard. May I be gentle with myself. Just putting your arms down. Feel your entire body soaking up the bright white light from before, completely covered in a beautiful, safe glow. Feeling relaxed and completely safe and at ease. We'll just return back to the room now with a nice deep belly breath in through the nose and a nice long sigh out. One more time, a nice deep belly breath in through the nose, feeling your body release. And a nice long sigh out. We'll wiggle our fingers and toes, do a nice gentle stretch, and slowly open your eyes. And just check in with yourself and notice if you feel any different from before. And use this as your evidence that you have some control in your body's state. And while it may not always be perfect, every little bit helps, especially on those really bad days. All right, thank you so, so much for joining me today. I really hope that you've learned some amazing tools that can help you find relief. Remember, these are meant to complement your treatment, so it can be good to do them during an awful flare up before the medication kicks in to really see them take effect. But again, always talk to your medical team before undertaking these types of practices. And if you're wanting to give pain focused meditations a shot, you can listen to my endo specific meditations by downloading the Mind Over Endo Pain app, or you can listen on Spotify, Insight Timer, YouTube, or wherever you get your podcasts. I just want to just give a massive thanks again to Quendo just for having me here, but also for all that the organization does. I am just so grateful for the opportunity to be able to do something like this. So a massive thanks to them for allowing me to do this and for hosting, and even bigger thanks to all of you out there who are listening and doing the work. I have no doubt that you are going to notice some remarkable changes on your journey, and I just really hope that this really, really helps with that. You've got this, and I'm so proud of you.